Nyikal, what is ailing the healthcare system in this country in your assessment? I know you've been a committee member for a while, you've been a doctor yourself. What is the problem?
I've been in the ministry.
Yeah, also in the ministry.
I've been in the ministry. Yeah. I've been in KMA, where he is now. As I said, the country is one, and the leadership is the same. And the ethos, I think where we are is the ethos of the nation.
Yeah.
What do people believe in? This is the problem. So what you are seeing in health is not very different from what you are seeing in this sugar thing, although it is a health. I don't think it's very different from what you are seeing in Sakawala. I don't think it's different from what you are seeing in the security system. People take positions in government with the idea of actually benefiting themselves at any cost. I think that is where we start from. So when people take these positions, they are not thinking of what contribution am I going to make? Am I going to really make a change? They are thinking, how am I going to benefit? I think in Kenya, when somebody is in senior positions, people tend to think of what house has he has, what car is he now driving, what schools are their kids. That is the basic thing. In health, the issue in health, particularly where we are talking about KEMSA now, is actually, again, at the leadership at the top level. It actually starts with the Ministry of Health. It could be higher. I know that. It could be higher. But so long as people who are appointed, one, are not appointed on merit. Two, if they are appointed, what are the behind-the-scenes instructions when they are being appointed? Three, do we give professionals their due position in management of issues or other things like politics and business and interests take over? I think that is the issue in health from time immemorial.
Yeah.
Yes. So that when you talk of procurement, and again a lot of it is around procurement.
Yeah.
That's what you have seen. Then the other one in health is human resource. Now, because you see, in treating people, you need the people who treat them, you need the equipment and the supplies that you treat them. If those are not in place in the health systems, those are very major health systems. Even when you go to infrastructure and equipment, again, the basic thing becomes procurement. So health is suffering from what every part of our system is suffering from, except that health is loud. It is loud for two reasons. It is an essential service. People need it. Everybody needs health. So that if there's a problem, everybody feels it and feels it quickly. It's nowhere you can say, let me just wait, I'll do it later.
Yeah.
Two, in the health sector, the human resource, the personnel in health, are actually very well educated people. They are people who are very well organized. They are in unions. They are in associations. So they bring out issues very quickly. That is why you are seeing more strikes in the health sector than in other places. It's not that like in agriculture or in water there's no problem, but there are no organized workers. But the issue is actually the interaction between the professional aspect of our health systems and the management systems and the political system. The political system is at the top, and it interferes, it gets into the management, then it gets into the professional aspect, and eventually the services.
Okay.
I would say that is where the problem is.
Yeah. I
say that because, well, these people would judge this. I think we tried relatively well between 2003 all the way up to 2008. I can say because I was there, and I really never felt pressure. We did, like this NETS issue. It's not new to me, because we had the same problem with NETS at the time. The procurement.
What is the problem?
Yes.
Because there's an issue in terms of changing the specifications.
But that one actually was sorted out at my level.
Yeah.
Not even, it didn't have to go to the peer. By the time we got to the PS level, we had sorted it out. There are interests. You see, in all systems, and health particularly, there must be somebody who is keen to protect the interests of the people. If you want to protect the interests of the people, you must be selfless. Because if you are not, then it will be very difficult to protect the interests of the people. So if the procurement, like say, health suffers from many things. If you talk of financing, it does not get enough money. The little they get, you have an issue. If you take of supplies, you talk of procurement. Again, huge interest in procurement. If you talk of the supplies, just the distribution, huge problem in the distribution of supplies. If you talk of regulation, well, regulation is not very profitable, but it still has a problem.
Yeah.
If you talk the management of human resource, that now is another big issue. In my view, these are things that can be done, but there must be commitment at the very top.
Okay.
At the very top. Let me just say it, starting with the presidency, and then at the ministry level, the minister, and then the PS, and then give the professional a chance.
Yeah.
The office of the Director General, what used to be the Director of Medical Services, that is really where the things are. If they have a hand, and those technical people are actually left to advise without people interfering, it will be okay. Now, we are talking here in this case of the requirements that were required, the specifications.
Yeah. Why was it necessary to change now that you've dealt with it?
Okay. It is just one insecticide against another insecticide. Whether you have pyrethroid or pyrethroid plus BPO.
Yeah.
So that should have been decided in 2019.
Okay.
Very fast action has been taken.
Yeah.
But there's something I'm still waiting to hear. Why was somebody finding it necessary 2-3 years later to change the specification? Long-lasting insecticide-treated nets. That was way back as 2005. By now, the country had agreed what are the nets that we use, the specification. So I would want to know why was it found necessary with these new changes? This was started with the last government. Why was it found with this new government to... I find it hard to believe that it is this permanent principal secretary sitting in her house alone and then suddenly deciding for whatever reason that I'm going to change the specifications. There must be other guys.
Okay.